Okay, so hello everybody. We talked about goring by a cow and how ossified stony nodules develop, especially when you've had trauma. Some of these can be congenital as well, and this is a case. And I was looking in the homeopathic literature to see if homeopathy had successfully treated the ossification of tissue in human beings. And it turns out there's a wonderful, wonderful case report of something called heterotropic ossification in a 7-year-old girl, treated by some very famous homeopaths, George Vitulkas. And this was printed in the papers published at NLM and in the NIH archives. And it's a wonderful, wonderful case study. And so without further ado, we'll go to the next one. This is a girl. This is a girl of about 7.5 years old who came to this Vitulkas' homeopathic clinic with a huge, extensive radiological signs of ossification. Ossification means bony nodules in your tissue. This kid was 2.5 years old when they first discovered this, right? She had soft tissue which had calcified. But her bones were okay. So there was no misalignment in the architecture of the bones. There was no fractures. There was no bone lesions. It was just these ossified, lumpy, bony tissues in her muscles. At that time, so her anti-nuclear antibodies were positive. There's a enzyme test for called LDH. It was very elevated. You will see this number 346. Remember this. Normal is 81 to 234, and her lactate dehydrogenase was very elevated. Okay, and so she was diagnosed at the tender age of 2.5 with juvenile dermatomyositis, which is a fancy name for having all these little blobs or little nodules in her underneath her skin. She was given cortisol treatments, prednisone, corticosteroid ointments, oral methotrexate, all sorts of extraordinarily poisonous things. This is the age of 2.5. 4 months later, nothing. The ossification continued to be acquired, and this can be acquired by trauma. It can be acquired by surgery. You know, when you cut yourself, sometimes you get an osseous calcification, or like in my case, I got gored and now I have an ossified nodule there. It could be from brain injuries, so you could have one of these in your brain, or extensive burns. And if it is in a bad place, it can immobilize you, as this girl was. She was disabled. So this is a picture of her bones. As you can see, this is when she was 2 years old. You see these little nodules, these little white spots here. They were starting to develop in the little poor two-year-old. And so she had bony nodules, obvious bony nodules on her face, her upper and lower limbs, and it started appearing not at birth, but at 2.5 years. I reckon it was something to do with vaccine damage, or she got some environmental exposure to something very, very toxic, because she didn't have it at birth. She was a perfectly normal child. These nodules were painful, especially at night. And every couple of months, she would get a nodule or two. And from time to time, these things sort of discharged from her body, leaving deep scars. And she had them in her elbow, so she could not extend her elbow. She couldn't extend her elbow. She could not squat because they were on her bottom. They were near her knees, her thighs. She was a shy girl with no family history of any major disease. So what on earth could it be? This is what she looked like.
Ooh.
She had nodules like this. She couldn't bend her elbow. She had nodules here, nodules on her rump, nodules in front, on all sorts of body parts, which basically disabled her. This is how she came to this homeopathic clinic. One interesting feature about her was she wrote backwards. When she wrote things down, she wrote mirror images. Do you see that 74 and 72? It's backwards. And so what classical homeopathy does is it looks at the whole person, not just at one thing, not just at her nodules. And based upon all the symptoms that happened to her, were happening with her, on April 19th, 2017, this was what, 5 years ago, she had painful calcific nodes. The symptoms were worse at night. They were worse from slight touch and motion. She had very offensive stools and urine, and she had smelly breath. She was a timid girl. She made mistakes during writing, transposed her letters, liked salty foods and butter, and did not like sweets. She was given 1 dose of Merc-Sol 1M, 1 dose. Okay, this was in April. Immediately the nodes stopped forming. From this, within a week of giving her Merc-Sol, the nodes, the calcific nodes stopped forming. On May 20, about a month later, she had no more night pains. She had gained 300 grams, almost a pound. She was much more active. This is a 7.5-year-old. No more new nodes. 2 old nodes became soft and discharged a lime-like discharge. So what's going on is the remedy is still acting. So they let the remedy act. They did nothing. April went by, May, June, July, August, something changed. All of a sudden, from not liking sweets, she was liking sweets. She loved sweets now. She was weeping. She was in a teary mood. She was shy about appearing in public. She still had offensive stool, but with constipation. She had a more dictatorial attitude, whereas previously she was timid. The change in personality. And she was still making mistakes when writing or transposing letters. And the big remedy for that, transposing and writing letters backwards, is lycopodium. She was given on 21st of August 1 dose of lycopodium. A lot of her those symptoms went away, the tearful mood, the desires for sweet, etc. And August went by, September went by, October, November, December, February. The patient was much more improved. The nodes stopped forming, but she continued to make mistakes in writing, and she had timidity and did not want to go to school. She didn't have confidence. She didn't want to go to school. The lycopodium 1 dose was repeated in February. So the lycopodium was allowed to act from August to February, that 1 dose, and then it was simply repeated because things got a whole lot better, but she was still making mistakes writing, February 2018. So remember, it started in April of the prior year. By February 2018, all the node formation, which has been going on from the age of 2, 3, 4, 5, 6, 7, 5 years, and she's completely disabled, gone. In September 2018, the nodes had softened as if they were ready to ooze. And 2 of them were very painful, very red from the slightest touch. So redness, throbbing, painful to touch, belladonna. Belladonna. The child is crying because of the pain. They want to break open. Belladonna. So you were very, very right to use belladonna for your boil, which was painful, just starting to form, starting to soften. So belladonna 1M, 1 dose was given, 23rd September, allowed to act September, October, November, December. And in December, all that remained was the body discharges. They were all, and the stones were discharging, and there were body discharges that were foul. Stool, urine, perspiration, everything smelled. There was itching in the nodules. She was eating her nasal crusts. The child was pulling crusts out of her nose and eating them, which is disordered eating, and she desired sweets. So she got 1 m sulfur, 1 dose, to take care of that. That was it. Since then, many years have gone by. Child is doing perfectly well, no problems.
Oh.
And here is the pictures. This is the hip, which was discharging 1 week after the remedy. 1 week after the, what was the first remedy? Anyone remember? Anyone remember what the first remedy was? Mercurius. 1 m. After the first remedy, the nodules started discharging. After the first month, there was no more night pains. The child was way more active. No new nodes reoccurred. 2 of the old nodes became soft and discharged. And then the classical homeopathy remedies were continued over time. This is how it fell off. Literally a crust of calcified crust of a nodule started falling out of her body. Expelled, this is expelled from her left arm.
Wow.
Then this is a radiological examination, beginning of the treatment versus 15 months later. So if you can see, did you see all these nodules down under? All of them have disappeared in the upper picture 15 months later. There's this nasty thing here on the left-hand side, filled with nodules in the back of her leg, all gone in the upper leg. There's nodules here, there's nodules here, there's nodules in the right leg, gone, gone, gone. The patient could now, there's a significant reduction in 15 months in the size and opacities of the calcified nodules. She can squat and extend her right elbow joint, which is awesome. And after 29 months, much more gone. And now, remember the lactate dehydrogenase enzyme. It was 349. Look at it now. It's now 294, very close to normal. So the anti-nuclear antibodies, her immune reaction is all stabilizing itself. Patient has no new nodes since the beginning of the homeopathic treatment. Actually, we did not observe any new nodes right after the first remedy, and now there is an improvement in the writing pattern. She's no longer transposing her numbers or writing them backwards, mirror images. So the basic premise here is what causes us to get sick. And guys, you are going to be tempted to use steroid creams. You're going to be tempted to use miconazole or Flagyl for your infections or antibiotics. None of those are going to fix the underlying problem. Only your body can fix it. And so the key to remember is that this issue regarding health and disease hinges on your body's ability to maintain homeostasis. Only your body can cure you. And this is an energy complex. This is not phosphorus and calcium and bones and muscles. This is your body's energy complex, which, for want of a better word, Hahnemann called it the vital force. And that is what defends you, creates health, creates immunity, fights disease, cures disease, and actually heals things gone wrong. When your energy complex, it's like a pendulum, right? If you bang it and it goes off on one side, if your energy complex goes off too far on either side or it's deeply affected, an imbalance is created in your organism. And if this continues or it's allowed to continue, it's going to have a huge effect on you. And it's like the weakest link in the chain. Some people get diabetes. Some people get heart disease. Some people get itches on their hands. Some people will get urinary infections all the time, anytime their body goes down. So it causes disease in the weakest part of your body. And so what the homeopathic remedies are doing is they're applying a similibus curantur approach to healing, which is they're assuming that your body's reaction to whatever is happening is correct. So if you have a yeast infection, you're going to get a homeopathic remedy that causes that causes the very symptoms of the yeast infection. Your body is making the right decision when it's giving you itches or this or that or cottage or pain. And when you give that similar remedy in a very diluted dose, which is, by the way, crossing Avogadro's number, see, that's below 10 to the 23 power. It is diluted to such a degree that there's nothing molecular in that solution, but yet it works. And that similar nudge to the body causes the body to react in a way that it gives it the illness or the disease, its healing force, and goes into homeostasis again. So people have laughed at homeopathy and said, you know, it's water. It's nothing but water. It's placebo. This girl didn't know about water and placebo. She's a 7.5-year-old kid. She didn't know. Her parents didn't know. What research has found out in recent years, there's a Chikaramane study in 2010. They looked at the presence of stuff in the liquid diluted titurations of homeopathic remedies, and they found nanoparticle source materials of whatever the homeopathic medicine was derived from in multiple ultra diluted solutions, way beyond Avogadro's number. Avogadro's number means 10 to the power 23. You dilute something times 10, times 10, times 10, times 10, 23 times until not a single molecule of that remains, but it turns out the nanoparticles do. Tourney and Roberts in their recent experiment have found that homeopathic dilutions of 50 m consistently and reading their source material reproducibly affected the absorption spectra of all 6 solvatochromic dyes tested when compared to control, meaning that homeopathic dilutions are not just water. There's something going on. And that brings me, and I'm gonna stop sharing here, that brings me to the point of not knowing. We need to be comfortable in not knowing some of the mysteries of nature. Hahnemann did not know about the mysteries of nature. He just saw what was working, and that's the true scientific method. You lay trips, you lay explanations on things that are half-formed or not known. He didn't go there. He said, I don't know why these dilutions work, but they work. And that is the basis of all homeopathic medicine, and that is the true basis, in my view, of all medicine. Whereas allopathic is opposite, homeopathy is similar. And so now I'm gonna stop recording so that we can talk and have a discussion and take it from there. So thank you, everybody.